My name is Trish Ware, and I am obsessed with all things pregnancy and birth and helping you to navigate both the practical and the magical seasons of this journey called motherhood. I'm an all-day coffee-sipping mama of 7. I've had the amazing privilege of delivering many babies in my 15-plus year career as a labor and delivery nurse and as a mama of 7. I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby. Quick note, this podcast is for educational purposes only and does not replace your medical advice. Check out our full disclaimer at the bottom of the show notes. Hello, everyone, and welcome to the Birth Experience. Today, we are joined by an incredible guest, Sara, who is the gestational diabetes nurse, by the way, and she's here to break down everything you need to know about managing your gestational diabetes during pregnancy. We're going to talk about understanding the diagnosis, and she's going to give you guys some practical tips for blood sugar control, mindset, and birth. And Sara has so much expertise, so I'm excited. Welcome, Sara. Tell us who you are and why you're the gestational diabetes nurse.
Hi, Trish. Thank you for having me. I'm so excited. So, I am a labor and delivery nurse. I've been a nurse for over 6 years, and my entire career has been in labor and delivery and women's health. So, I definitely this is my jam. And basically, as labor and delivery nurse, my first job, I noticed right off the bat that lack of prenatal education really impacted my patient's birth experience and just really caused birth trauma and ultimately affected their health and well-being for them and their baby postpartum. And then when I switched to my second job, which the basically the clientele of my patients were more educated, I was like, oh, like let me see like the difference. And I felt like yes, they were more educated, but they still lacked that prenatal support and education as far as labor and their diagnosis and like all the different things that go into every single person's unique motherhood and pregnancy journey. And ultimately, again, their postpartum experience can be negatively impacted by, their lack of education and support prenatally. So I got this awesome opportunity to start working as a high risk OB nurse. I'm actually a contract nurse, so I got to see like a little bit of everything, which is awesome. And I got to piece both worlds together and see like, okay, as an OB, high risk OB nurse, I'm talking to these mamas and developing a relationship with them every single week. They come at least once a week or twice a week, depending on their diagnosis. And again, I see like, yes, we have resources for where I work, which is MFM, maternal fetal medicine. We do have diabetic educators that meet with these mamas, depending on their control of their diabetes, either once a week if it's really not controlled, or every 2 weeks or 3 weeks. They do telehealth visits with them, but they're still lacking the support because how much can you teach or educate a mama in 30 minutes, really? So as I was taking care of these mamas, which my role is doing NSDs and BPPs, so I spent a lot of time with these
Yeah.
mamas. And basically, I actually got certified in BPPs also, which is awesome. So as I'm putting them on the monitor and as I'm doing the ultrasounds and spending over an hour with them, I ask them like, how are your sugars? What difficulties are you facing with, your postprandial sugars? What difficulties are you facing with your fasting sugars? And how are you feeling with this pregnancy? And it was so astonishing to me how the lack of support really was a common theme, and they all had the same questions. What's going to happen to my baby after I deliver? Can I breastfeed? And I was so astonished by that. And I said, I love helping these mamas, and I really truly it's a passion of mine to educate these mamas. But I decided to take that to the online space and just really help even more mamas. So yeah, that's what I'm doing now. Really just trying. I know I can't fix the system. We can't, we, not all of us, our hands are tied, but helping one mama at a time is just amazing. And I really do want to help as many mamas as I can with their diagnosis, with their pregnancy, to have a healthy baby, to have an amazing delivery, their dream birth, and then postpartum to just recover postpartum and bounce back, as they say. But yeah.
So let's start with this. Like, what exactly is gestational diabetes or GDM, as a lot of
Yeah.
people, and how is it diagnosed?
So I love that question. Gestational diabetes is diagnosed when you take your first hour glucose test. It might be, if it's elevated, they'll have you take the 3 hour glucose test. So after you fail the 3 hour glucose test, they diagnose you with gestational diabetes. And that's typically around 24 to 28 weeks. Sometimes they do it earlier if you have any risk factors for that. And really, what it means is it's so common, Trish, but really what it means is that your body is just not producing either enough insulin or the hormones of the placenta are impacting insulin resistance and causing insulin resistance, really. So it's just everyone is different regarding gestational diabetes, but it's something that can be controlled, and it's something that you can still have a healthy pregnancy with this diagnosis. So it sounds a little scary, but it's so common now.
Yeah, and I think that is really important to
Yeah.
note. And I'm glad you said that because I tell my mama members and my students, they all are so afraid of getting diagnosed. I'm like, no,
Yeah.
knowledge is power. You
Yeah.
already have it if you have it. Like it's happening. You need to know about it so you can handle it. So
Exactly.
if you're listening out there and you've just gotten diagnosed, I just want to say the same as what Sarah's saying. You didn't do anything wrong. You're not at fault. I've known people who are super fit who end up and
Yeah.
people who are not fit at all that end up with it, people that eat really healthy that end up, and people that don't. So I love that you said that. So now they're diagnosed, what are
Yeah.
some first steps that you would recommend?
So once you're diagnosed, we kind of try diet first, which is great. We don't go straight to medication. And honestly, we see such a big difference when you start implementing healthy lifestyle choices. And the second thing I want to say is that exercise has been proven to really help manage your blood sugars. I always have mamas tell me, like, yeah, I noticed after I ate, I went on a walk and my blood sugar got much better, which is something so practical to implement. So those are like really like key things to start with. With as far as diet, so I live in New York and it's really hard to tell like a melting pot of people like stop eating rice when it's part of their culture, right? So what we do is we recommend that if you want to eat a carb, you pair it first of all with a protein, whether it's an animal protein, whether it's a plant protein, and then you add like some avocado, which is a healthy fat to balance it out. And then you walk after you eat, and then increase your fluid intake, your water, and that really helps manage your blood sugars as well. So those
I
are like
love
really,
that.
yeah.
So they don't have to, like, you, what Sarah's saying is like there's options, and I love that. And you guys can find Sarah on Instagram. Your handle is,
Gestational diabetes nurse.
there you go. Very straightforward and easy. And she can give
Yeah.
you more tips on what to eat. And the other, so like, are there specific foods that are like, no, ma'am, out of the question? Or is it all
Um,
moderation?
it's really moderation. It's hard to tell a pregnant woman like, I mean, you don't you don't wanna overdo it, like, eat, like, donuts and ice cream, like, all day, and cheat days are kind of, like, also a little tricky. If you are craving a carb, I recommend you pair it with a protein, you eat it with a healthy fat, you drink a lot of water,
And go for a
and
walk.
go for a walk,
Yeah.
exactly, and also try not to make it most of your plate. So get a smaller plate and do like a third of the plate, whatever you're craving, whether it's French fries, whether it's a burger, and then pile on some salad, pile on some avocado. Make it simple, but you can have a little bit of what you're craving, but you also want to make sure it's not like overboard,
Yeah.
so you
Yeah.
can manage your sugars.
So, all right. So let's say mama is keeping her blood sugars managed, diet controlled. How is her birth affected? And we're talking right now for diet controlled first.
Okay, for diet control, I love that question. Actually, there are patients that doctors let them go past 40 weeks if you're diet control and your baby's growth is normal, right? So we look at the baby's growth. We make sure the baby's belly is not too big. We call it the abdominal circumference. And then we make sure that you don't have poly, which is polyhydramnios, which you know, Tris, is a lot of water, a lot of amniotic fluid. So a lot of doctors have been letting patients, late, like not inducing them at before 40 weeks if you're diet control, which is awesome. And then for Medicaid, yeah, go ahead.
Oh, I was just going to say, my moms that are listening are like, uh-oh, because I don't like the term let them, because
Yeah, I know.
ultimately it's up to you as the mom. And inside my world, we say we don't refuse things just because we can. But for most of you guys listening, if you are diet controlled, even if your doctor is like, and I'm saying this in quote, not
Yeah.
letting you go past 40 weeks, you can go past 40 weeks.
Yeah.
But I do recommend you go see someone like Sara, you get your NSTs, you get your BPPs, you
Yeah.
keep an eye out. But just remember, you guys have choices. Even if you have like the worst doctor in the world who is like completely induction happy for everyone, you don't like, I always tell my students, like, the induction police don't come out to get you. Like, you
100%.
can do what you want, just be smart. Yeah.
We see it all the time. And I was gonna add also, as long as your NSTs are reactive and your BPPs are 8 out of 8, which is 10 out of 10 with an NST, then we are reassured when you continue your pregnancy. So that's a really key component. Yeah. So, and a lot of doctors, I feel like a lot of doctors have been okay with not inducing, as you
Yeah.
say.
Yeah.
And if your doctor isn't okay with it, you can always switch.
Yeah. And you don't have to. So a lot of times what will happen is these doctors' offices will schedule the induction without you really playing a
Yeah.
part in that. And you don't have to do that as long as you and baby are healthy. Okay, so the difference here I want to really emphasize is if you have a mom who is on medication, well, and even if you're on some medications and you're controlled, you don't necessarily have to be induced. But what about a mom who her blood sugars are not staying in control? She's having to take insulin. She can't get it. She's just not maintaining. Like, what's your thoughts for them?
So I would reach out for help. I would love to help you with that because we need to maintain normal blood sugars, not just for the baby, but for you. There can be complications for you as well. Preeclampsia is very common. If your blood sugars are uncontrolled, you can have high blood sugar levels and go into DKA, which is an emergency also. So I would definitely reach out. We're all willing to help you, and we want to make sure your blood sugars are in control for your baby as well, because if your blood sugars are not in control when the baby's born, the baby's used to so much blood sugar, so it produces a lot of insulin, and then when you take that blood sugar away after you cut the umbilical cord, the baby's blood sugar will drop. And that's the issues that I faced as a labor and delivery nurse when my patients' babies' blood sugars were so low, and I had to keep running back and forth to the NICU, and then they would ultimately recommend formula, and then ultimately baby would go to the NICU because it just wasn't stabilizing because of uncontrolled diabetes. So that's
Yeah.
really important.
So, for those of you guys listening, one of the things that I recommend, and I'm sure Sara would agree, is to collect some colostrum
Yeah.
before. Like, not all of you have to do that, but if you do have GDM or there's something else, maybe you know your baby's going to have a cleft palate or something like that, coming in with colostrum already collected. My favorite are the Haka ones. And you can have that collected. So, if that situation happens, like Sara just said, they can give your baby colostrum instead of formula. So that's just a
Yeah.
little side tip. Okay, so
Or
oh, go ahead.
sorry, or we can give glucose gels. So my first job that I worked at, we didn't have it, but my second one we did, and it really, really helped because we would give the baby some glucose gel and then we would latch the baby on with for the mom, and the baby's blood sugars were able to rise and level out. So that's a great option. Also, you should definitely ask that when you're in labor and delivery. Hopefully you don't have that situation, but
Yeah.
that's a great option.
Yeah, instead of formula. I
Yeah.
love that. Okay, and so one of the things that I see inside my community is that there's a couple things emotionally. They feel a lot of guilt
Yeah.
and they feel overwhelmed. So I love that you've created, tell them a little bit about what you've created with the gestational diabetes nurse.
So I do offer one-on-one consultations because I know some people just really benefit from that. But I do have a membership, which I'm so excited about because it's a great community. Because, like you said, mamas feel like guilty. And honestly, you're not alone. So many women face the same issues and they all feel some similar emotions as you do. So, and you could bounce back off each other and get that support from each other and then grow together. And it's just such an amazing community. And then we do offer support, for postpartum as well. And I forgot to mention, I do childbirth classes as well, which is awesome. So we'll help you prepare for your delivery, for your dream birth. But I do focus a lot also on postpartum because I've seen like such a big lack for that in my current role where I am working in MFM. The patients are so like, oh wow, like I have somebody checking in on with me every 2 weeks or whatever it is from the diabetes team. But then once you deliver, it's kind of like you're on your own, which is really sad because gestational diabetes, yes, it can go away and it does go away most of the time, but you still need to make sure that the mother has support and education. And a lot of them don't know they need to retake the glucose test 4 to 6 weeks postpartum. And then continuing to implement healthy lifestyle choices to decrease your risk for diabetes later on in life. So we do really support women with, postpartum because it's such an important time where a lot of people just forget about you. And we don't forget about you. We're here for you every step of the way.
I love that. So one of the other things that I hear a lot of women are like, okay, I had GDM with this pregnancy.
Yeah.
Will I have it with all of my pregnancies?
So a very common question. So it depends on your lifestyle choices postpartum, like I said. And I've seen how it's so funny because I've been working at this center for a while now. So I've seen women that get pregnant, like, postpartum right away. And they can go from GDM1, which is diet control, and then their second pregnancy, they need medication or they're diagnosed early. So yes and no. It depends on how you educate yourself, you get the support, and you make the lifestyle changes. And they don't have to be crazy ones, but it's just continuing whatever you learned in your pregnancy, you continue postpartum. And really, that will give you the key to help you have healthy pregnancies for the rest of your life and just a healthy, lifestyle without just postpartum. You'll be healthy, which is really important.
I love that because I think that is a huge concern. Okay,
Yeah.
so what are some like okay, I find you find yourself saying this a lot to your members or to your patients in person. What are some like little bonus tips you can give these moms that you want them to know?
You are not alone. You can have the most amazing delivery experience. You can have the most amazing postpartum and really implementing these small, like I said, just take walking after you eat. Even when you're postpartum, just taking your baby in the stroller and just walking after you eat, it's just really gonna benefit you pregnancy and postpartum. And I've seen women do extraordinary things. I've seen a woman have uncontrolled diabetes, taking medication, and then going from that to diet control. I've seen women postpartum lose all the weight and just be completely healthy and next pregnancy pass their GDM test. So you really can do it. And just these small tips really are beneficial. And yeah, it's
I love
really,
that.
yeah.
I another question I have that I meant to ask before, but I definitely before we get off, I want to say like what can they expect during labor?
Okay.
What are the particulars for them during labor?
I love that question. During labor, you're going to have the same labor process as every other woman. Labor is labor. The only difference in labor when you have gestational diabetes is that we check your glucose, your finger stick, it depends on the organization, but every, 2 to 3 hours. Sometimes some hospitals check it more frequent when you're in active labor. Another thing is that we may like change your IV line. So if your sugar is on the lower end, we'll give you like a certain, like we'll give you LR with D5. If it's on the higher end, we'll give you normal saline. Some organizations do that. If your sugar is high, we might start you on an insulin drip. Again, that might affect, baby sugar when postpartum, but we do have to do that to regulate your blood sugar during labor. But otherwise, it's the same labor process. It's really not different. It's just checking your blood sugars, making sure your blood sugar is normal so that baby's blood sugar is normal as well.
Is it common for women who are, let's say, diet controlled to have problems with their blood sugar during labor?
Not at all.
Okay.
Usually they're because they always tell me my fasting is perfect.
Mm-hmm.
So,
Yeah.
like in pregnancy, they always tell me my fastings are perfect. And then when they're in labor, it's usually like totally normal values. It's really the women who have uncontrolled diabetes and my type 1s. Usually the
Okay.
type 1s they need to be on an insulin drip just because they're on the insulin pump during pregnancy. But the women who have uncontrolled diabetes, they're usually the ones who are on insulin drips during labor. But otherwise, it's totally the same labor process, nothing different.
So you guys, I'm asking, I obviously know the answers to these questions, but
Yeah.
I want you guys to hear. So a mom who has diabetes, controlled or uncontrolled, can they go unmedicated without an epidural?
100%.
Okay, because that's one of their fears. I hear all the time, like, no, I can't have the birth of my dreams. Yes, you
No.
can.
Yes, you can.
You can. Okay, what about for baby? For a mom who's GDM during pregnancy, what does it look like for baby after birth?
So after your baby is born, we're not going to be checking your blood sugars anymore, but we are going to be checking the baby's blood sugars. So usually we put the baby skin to skin, which helps maintain normal blood sugars. And we usually keep the baby on you for at least an hour. As long as baby's pink and crying and everything is great with the baby, we'll keep the baby on you. Then we'll check the blood sugar and the weight 1 hour after. If the blood sugar is normal, we'll check it 3 times, like every hour for 3 times. And then once again in 12 hours, and then once again in 24 hours, and then the baby's done. If the baby's blood sugar is low, then we will give the baby glucose gel. We'll help the baby latch and help you breastfeed, and we'll check it again. Every organization is different. This is just where I work. And then we'll recheck it 30 minutes after you finished feeding. And then if it's still low, we'll do the same process. Obviously, we'll call the provider and just let them know. Usually it's NICU or whoever. And we'll do the same process. If it's 3 consecutive low sugars, which means the baby cannot maintain normal blood sugars with the glucose gel and feeding, or if it's just a critically low value, the baby will ultimately end up in NICU, but that's not so common. Only because it really happens if the mother's sugars are uncontrolled or if the baby is super, super small or super big. Sometimes that can happen too. But usually it's not the case day by day. Yeah.
I have a terrible story. So when I
Oh.
had Lainey, my baby number 5, so long story short, the place that I delivered her, I also worked at. And we used to check every baby's blood sugar.
No.
And what was funny is I didn't know that wasn't normal. I did my first tribal assignment and I'm like, you guys aren't checking the baby's blood sugar? And they're like, not unless she's GDM. And I was like,
Yeah.
oh. So when I got back to my facility, I looked up the policy and someone somewhere misread the policy. So we have been doing this and it wasn't policy, but that's a side show. But I have Lainey. The nurse checks Lainey's blood sugar and it was critically low. So they rushed her to the NICU. She gets to the NICU, they check it again and it was totally fine. So it was the machine that was wrong.
Oh no.
Yeah. It was like, wait, what? Because I was like, what? So that was my horrible story. Okay. So let's just, for these moms, what would you say would be like, so I'm going to just say this for you. Your number one tip is how to combine the foods, take a walk, and drink more water.
Yeah.
And that's going to really be a frontline war
Yeah.
defense.
And portion control.
Okay.
Yeah.
Yeah. I love that because I feel like that is simple
Yeah.
advice.
And meal prep. I didn't mention meal prep, I forgot to, but meal prep is so important because if you're waiting to the last minute and you're starving, and when you're pregnant and starving, it's not a good combination.
No. Yeah. No.
Yeah, so then you'll just eat whatever's in sight. If you meal prep and you, which is a great tip when you are postpartum and you have a newborn and you have toddlers, you need to meal prep for that. Like this is preparing you for that. Side note, when you meal when you meal prep, you take the stress and just the guessing game out of everything, and you just know like, okay, this is my breakfast, this is my lunch, this is my dinner, and you have these small snacks throughout the day to space them out so that you're never really hungry and you feel full. The goal is for you to get all the calories that you need because you are growing a baby. You can't take away carbs from a pregnant woman that's growing a baby, right? So that's really the goal also for meal prep. I would just recommend in the beginning of the week or however your schedule is. Obviously, you want to make it realistic, do shopping in advance and then plan out what you're going to eat and have like if you're going to eat, for example, I recommend apples and peanut butter, right? So okay, so prepare like the snack before like the night before so that way when you're at work or whatever you're running around with your toddler, like you have these things on hand so you're not going to be eating foods that are potentially going to spike your blood sugar.
I love that so much. Okay, so before we get off of here, I want you to tell everyone again where they can find you
Yeah.
and just any other. So let me just say I didn't say Sara is a mama. She also has
Yes.
children.
Yes.
So she's been there, done that. So tell
Yes.
everyone where they can find you.
Yes, I'm at Instagram mostly, gestational diabetes nurse. That's where you can find me. I have so many tips for you guys, so many meal ideas for you guys, labor tips, postpartum tips. So it's just a really great place to hang out. And you could definitely message me if you have any questions and join the membership and find a community of mamas just like you.
Oh, I love that so much. Thank you so much for coming on today, Sara.
Thank you so much. This is so amazing.
Wow, what an insightful conversation with Sara, the gestational diabetes nurse. Managing gestational diabetes might feel overwhelming. I get it. I see you. But with the right information and support, you can take control of your health and your baby's well-being. You can have a beautiful labor and delivery. If you loved this episode, hit subscribe. Leave a review and share it with a mama-to-be who needs this support. And don't forget to follow Sara for more tips and expert advice. Her insights are invaluable. Until next time, stay informed, stay empowered, and remember, if you write a review, we'll put you in a drawing for a special little gift. And we know you are so much stronger than you think. I'll see you again next Friday. Bye for now.